Hello and welcome. We start with the news of Prime Minister Narendra Modi having had a telephone conversation with US President Joe Biden. The two leaders discussed the COVID situation in their respective countries, including India's ongoing efforts to contain the second wave of coronavirus through expedited vaccination efforts and ensuring supply of critical medicines, therapeutics and healthcare equipment. I'm joined at this hour by my colleague Sunil Prabhu for more on that story. Sunil, if you can get us up to speed with what more was discussed during this telephone conversation between the Indian Prime Minister and the US President.
Well, as you're aware, India and United States understand that India is going through a national emergency. If you see the two statements, one by the White House and one by the Indian government, there are, of course, differing perceptions about what exactly transpired in this telephonic conversation. The Indian side has a huge litany and a huge spiel in terms of what transpired, not only about the shared cooperation and about how they need to go forward in terms of fighting COVID and what India's efforts have been in terms of the vaccine Maitri, as well as Quad vaccine, as the Prime Minister pointed out. There have been a number of steps that have been taken and really thanking President Biden for coming out to India's support at this national emergency where they require all kinds of possible assistance from oxygen concentrators to the most important, that is the raw supply for the vaccines that are required at this stage. Having said that, the President as well as the Prime Minister, according to the Indian side, talked about the trips and the need to ensure that there's equitable justice in terms of those who have access to the vaccine across the world. But of course, from the White House side, if you see their statement, it's a little bit more bland, very clear-cut that they are giving out doles at this stage to India. Either way, whatever the perspective is, India is in a dire state of need at this stage, and we are waiting for the United States to not only give us raw materials for the vaccines that we require, but to really handle this pandemic and help us at this very, very dire situation that we are emerging at in the given point of time.
Thank you very much, Sunil, for getting us those details. Now, this is the fifth straight day when over 3 lakh cases have been recorded in the country. 3,52,991 fresh COVID cases were reported and 2,812 deaths. India saw a new record high as the deadly corona wave swept the nation. Nearly 10 lakh cases have been reported in the last 72 hours, 242 cases per minute. On 24th April, the case figures were about 3,46,000. On 25th, it rose to 3.49 lakhs. On 26th of April, which is today, it is over 3,50,000. Now, the Election Commission is singularly responsible for the second wave of COVID-19 and should probably be booked for murder, says the Madras High Court. In the sharpest criticism yet of crowded campaigns for the 5 state polls that continued in the middle of a raging virus cases, the court has threatened to stop the counting of votes on Sunday if a blueprint is not put in place. In Bengal and in UP, Assembly and Panchayat polls were held amid the spike. 35,311 cases were reported in Uttar Pradesh as polling was held for over 14,000 panchayats. For 7th time in 30 days, polling was held in Bengal.
For the 7th time in the last 30 days, voters queued up in Bengal. But the excitement of the early phases has turned into fear of the virus and outrage at the polls going on as if it was business as usual and there was no COVID surge taking lives.
But since it's there, we have to come and give it. We cannot fear COVID and not give our vote. We need to take our precaution and give the vote.
Basically, I think like it could have been curtailed, The EC should have taken a call But I think they also did not expect this to happen. So I think now we are faced with this.
The words of the Madras High Court Chief Justice resonated with doctors. In Bengal, the positivity rate is 7.3%. But Kolkata hospitals and testing centers say every second person coming in for a COVID test has the virus.
Earlier, when we were doing 500 tests, we had 20-30 positive in January. Now, if we are doing 1,000, 500 are turning out to be positive. So we have 50% positivity, those who come to us for the sample.
The struggling doctor, in the state, in the city, when healthcare has been frankly overwhelmed by the magnitude of the problem, in some ways, we are grateful for the High Court to have taken cognizance of the problem. But is it a fact that we are trying to shut the door when the horse is bolted?
Politically, Trinamool and BJP are still squabbling. Even on the last day of campaign, the BJP chief held a virtual rally that some BJP supporters did attend. Mamata Banerjee too held a virtual but indoor campaign meeting, that too sparsely attended.
Election Commission ke আমি কাঠগড়ায় দাঁড় করাতে চাই। আজকে কোভিডকে বিশেষ করে মাদ্রাজ হাইকোর্ট যা বলেছে যে কোভিড বাড়াবার জন্য ইলেকশন কমিশন ইজ অলসো রেসপন্সিবল। নরেন্দ্র মোদি and election commission both are responsible.
Maharashtra, Uttar Pradesh, Delhi, they don't have election. So when they don't have elections, how you can say that for spread of corona election commission is responsible? That is defying my logic.
The last votes being cast on the penultimate day of the elections. 29th will be the end. After that, counting on 2nd May, when both votes and the COVID count will be watched with great anxiety. With GD Shankar, Monideepa Banerjee, NDTV.
Moving to the capital, Delhi has recorded the highest daily deaths till date. 380 COVID deaths have been recorded in the last 24 hours. 20,201 new COVID-19 cases in Delhi have been reported in 24 hours' time. Now, Delhi High Court has slammed centre over oxygen shortage. They've said, have been told that an oxygen cylinder costs 1 lakh now. It is your responsibility to ensure oxygen is available instead of taking care of patients. Hospitals are coming to us for oxygen. Now, we fail to understand why asked you to consider reworking allocation. Lives are being lost, not because of non-supply by us, says the centre, but oxygen not reaching hospitals. It's not our job, says the High Court. Centre, of course, says it's your job. Both governments are responsible. High Court says lives have been lost. Some action needs to be taken. In Maharashtra, cases have seen a dip. 48,700 new cases and 524 COVID-19 deaths have been reported in the state today. Case fatality rate in the state is 1.5%. Positivity rate is 16.72%. Now, Mumbai cases have dipped too. 3,876 fresh cases, 70 deaths have been reported in 24 hours. A total of 28,328 tests were conducted. The positivity rate is 13.68% and recovery rate is 87%. Now, in Mumbai, daily testing dropped by 29.70%. Only 28,328 tests were conducted in Mumbai on 25th of April, which is yesterday. Currently, 40,000 tests are done on an average. Mumbai recorded a drop in cases. However, in spite of strict restrictions, several other cities continue to have a high case load, and the climbing death rate remains a big worry.
While cases seem to be showing a drop in Mumbai, the rising fatality rate is a huge worry amongst doctors. From 0.53% between 5th April to 11th April, it has crept up to 1.51% in Maharashtra. Mumbai's death rate has risen from less than 1% to 1.15%. Worryingly, districts like Solapur, Nanded, Osmanabad and Yavatmal are reporting higher deaths.
ये जो पेशेंट्स की जो मोर्टेलिटी बढ़ी है, ये सब पेशेंट्स जो है वो शायद पिछले 15-20 दिनों में जो थे इन्फेक्ट हुए थे, तो मोर्टेलिटी में भी घटौती आने के लिए नंबर्स को थोड़े और हफ्ते कम रहना पड़ेगा, तभी जाके हमको मोर्टेलिटी जो है कम दिखेगी.
Mumbai reported the highest number of infections in a day, 11,163 on the 4th of April. The positivity rate was 22%. Now, after 3 weeks, the positivity rate is down to 14%. The number of daily infections is down to around 6,000 for the last 2 days. The task force set up by the Maharashtra government believes that Mumbai has already seen its peak in the second wave.
पिछले हफ्तों में जो मुंबई के आंकड़े आए हैं वो काफी प्रोत्साहनकारक हैं और धीरे धीरे कम होते हुए दिख रहे हैं. स्वाभाविक है कि हमको लगता है कि जो अप्रैल की शुरुआत में आंकड़े थे और जो पिछले हफ्ते के आंकड़े थे, उस वजह से शायद मुंबई का जो है पीक पहुंच के केसेस कम शुरू होना चालू हो गए होंगे. ट्रेंड तो फिलहाल ऐसे ही दिख रहा है.
गवर्नमेंट ने जो स्ट्रिक्ट पॉलिसीज ली है, महानगर पालिका आयुक्त ने जो पॉलिसीज बनाई है, उसका असर दिख रहा है और कुछ दिनों में काफी कम होने की आशंका है.
However, the worry is that testing has also declined. More than 50,000 tests were taking place in the city before April 16th. During this period, the positivity rate was also above 18%. Since April 17th, the testing has fallen from 45,000 daily to 40,000 daily and the positivity rate has fallen to 14%. Given the number of cases and deaths in rural districts, the Aurangabad bench of the Bombay High Court has ordered strict implementation of restrictions, saying that any person who steps out beyond the relaxation period will have to carry their Aadhaar cards, including medical and paramedic staff. In Mumbai, with Pooja Bhardwaj and Sunil Singh, Saurabh Gupta, NDTV.
Welcome back. The COVID crisis has shown the emergence of a young crop of leaders cutting across party lines who are helping citizens connect and access resources by coordinating with agencies and helping through their own initiatives like parallel helplines, food distribution programs.
We're just like searching for beds all over the place. We're trying on Twitter, we're calling the wards, we're trying everywhere. And a lot of strangers and friends also tried, like we were just trying for hours together, trying desperately to get an ICU bed. And somehow we reached the Aam Aadmi Party helpline and we managed to find like Ruben and a few others on Twitter.
Arun Suryanarayan's dad has finally found an ICU bed and is recovering. He says it was not just getting the bed, but from arranging an ambulance to checking up on them, the help was prompt. And this is how it has been for Ruben Mascarenhas for the last few days.
Good morning, this is Ruben from the Aam Aadmi Party. How can I help you, sir? Yeah, Ratna, just mention me the patient's vitals.
Patient SpO2 is 65% with with a bypass support. Sir, HRCT कितना है patient का? 15 out of 25. 15 out of 25, Ruben. And the patient is currently in Bhandup West.
No, but is the patient COVID positive? Is an RT-PCR test done?
The COVID negative.
Sorry, COVID positive, right? COVID positive. Okay. And what is the SpO2 right now on BiPAP?
65.
65. Okay. And where is the patient right now?
PG Multi-Speciality Hospital, Bhandup.
Ruben Mascarenhas isn't a doctor nor is he a government officer taking down details of a patient, but he reconfirms every detail. His party set up a helpline after the call volumes climbed beyond his individual capacity, fielding panic calls from those looking for ICU beds or medicines, or even plasma from their homes, as the pandemic means restricted movement.
We, as part of Aam Aadmi Party Mumbai's initiative, run a COVID helpline, a 24-hour COVID helpline on our number 771-881-2200, and we invariably get anywhere between 500 to 800 calls on an average. The calls have been progressively reducing over the last 2 days, to be specific. And today's call was basically an escalation. So we have about 50 volunteers who answer calls throughout the day.
The team gets on the job every morning, calling hospitals and the BMC control room. All admissions happen through the BMC ward war room, which is the protocol. Several young politicians across party lines like Ruben Mascarenhas from the Aam Aadmi Party, Rahul Kanal from the Shiv Sena and Zishan Siddiqui from the Congress have been active in Mumbai throughout the pandemic. From remdesivir to beds to ventilators to food, they are helping in whatever way they can.
बहुत से फ़ोन ज़्यादा करके रेमडेसिविर के लिए आते हैं, उसके बाद अगर आप देखेंगे तो आईसीयू या वेंटिलेटर को आते हैं। रात में जब मुझे लगता है कि कोई ज़्यादा फ़ोन नहीं उठाता है तो मेरा फ़ोन बजता रहता है 12 से लेके 6-7 बजे, और ट्विटर पे भी थोड़ा होता है कि आईसीयू बेड्स की ज़रूरत होती है। मगर कई बार ऐसा होता है कि मुझे खुद वॉलंटियर को हमारे वॉलंटियर्स, हमारे जो टीम है, उनको हॉस्पिटल तक भी भेजना पड़ता है रिक्वेस्ट करने के लिए कि अगर आपके पास अवेलेबिलिटी है तो प्लीज़ ये पेशेंट को रख लीजिए।
50 to 70% हम लोग वहाँ उस रिक्वेस्ट को पहुँच पाते हैं। काश ऐसा भी टाइम हम लोग देखें कि 100% रिक्वेस्ट हम लोग कर पाए, क्योंकि कई चीज़ें ऐसी होती है क्या जो ह्यूमनली हमसे किसी से भी पॉसिबल नहीं है, तो वो चीज़ों में हम फेल हो जाता है। बाकी का रहा बेड्स की बात, रेमडेसिविर की बात, हाँ डिले होता है, वो ज़रूर हम मानते हैं क्योंकि आज परिस्थिति ऐसी है, पर हम पहुँचने की पूरी कोशिश करते हैं।
A crisis means all hands on the deck and young politicians are standing up and being counted. In Mumbai with Sohit Mishra and camera person Sanjay Mandal, Saurabh Gupta, NDTV.
The Tamil Nadu is doing relatively better than most states when it comes to health infrastructure. What has helped them make a turnaround? Here's a report.
At COVID screening centres like these in Tamil Nadu, health workers prioritize patients after a series of tests, including an X-ray, CT scan, blood count and oxygen saturation. Asymptomatic patients are advised home isolation. Those with mild symptoms are shifted to a 5-day stay at Corona Care Centres or Corona Health Centres. Only about 10% patients with severe symptoms are admitted in hospitals with oxygen, ICU and ventilators. This way the state ensures only those who need critical health care get it at government hospitals. Arun, a budding assistant film director, has been advised to rest at a Corona Care Centre.
I can't be in quarantine in my home. There is no separate bathroom, right? So,
is this better in that sense?
Yeah, is this better because my family will be safe.
Jawahar's daughter, who tested positive after a family tour, would be on home isolation.
The service is very good. In fact, I didn't expect they were so quick and prompt. It was really fast, well coordinated.
Tamil Nadu has over the years prioritized public health infrastructure. As against 0.55 beds per thousand population in the country, Bihar has 0.11 beds per thousand population. Tamil Nadu has 1.1 beds per thousand.
If we follow this discipline, then there is no question of shortage of beds at all. All those things we have factored in. I'm not talking about just the 4,000 cases. I'm even anticipating an increase up to 6,000 or even 7,000 in another 20-25 days, because that is where...
Is that the projection?
Yeah, that is what the projections are also.
Public health care has always been on the agenda of political parties in Tamil Nadu, and the state has focused on building its infrastructure and a cadre of healthcare professionals spread out across the state, working on weak areas post the first COVID wave. In Chennai with Suresh, Sam Daniel, for NDTV.